Good morning, everyone, and thank you for tuning in to the Back to Mac Faculty and Staff Town Hall. My name is Susan Ty, McMaster's Provost and Vice President Academic. It is my sincere pleasure to be hosting this event this morning. Though we are gathering virtually today, I'd like to begin by acknowledging that McMaster University stands on the traditional territory shared between the Haudenosaunee and Mississauga nations and is protected by the Dish with One Spoon Wampum Agreement. Over the course of the last week, we have received approximately 400 questions from faculty, staff, and students from across McMaster about return to Mac. This is a tremendous amount of engagement, and thank you for your interest. I know McMaster's staff and faculty have been working incredibly hard for the last year and a half to keep our operations running throughout the ever-changing public health guidelines, uncertainty, and challenges. I want to wish to sincerely thank all of you for your hard work, your patience, and compassion. It has been truly seen and noticed by all. I would also like to take a moment to thank those that have been working on campus throughout the last year and a half throughout the pandemic, members of our joint health and safety committees, and those who work in various areas across the university to support our safety, our health, and wellness. Thank you very much. We will do our best today to answer the most frequently asked questions that we have received, and we will cover a range of topics. The sli.do platform will remain open during this event, and you can add your questions by using the URL and the code on the YouTube frame. We will also be using these questions that we receive from sli.do throughout the next coming months to actually share information with you as the gradual transition back to campus continues and as COVID-19 information is updated. I want to thank all our leaders from McMaster who have joined us on this panel this morning to answer your questions about the fall. Today's panel includes Dr. Paul O'Byrne, who is Dean and Vice President, Faculty of Health Sciences, Dr. Karen Mossman, Vice President, Research, Dr. Kim Dai, Acting Vice Provost, Faculty, Dr. Arig Al-Shabah, who's Associate Vice President, Equity and Inclusion, Ms. Debbie Martin, Assistant Vice President and Chief Facilities Officer, and Ms. Wanda McKenna, Assistant Vice President and Chief Human Resources Officer. I will now turn it over to our President and Vice Chancellor, Dr. David Farrar, to say a few welcoming words. Over to you, David.
Good morning, and welcome to the Back to Mac virtual town hall for faculty and staff. I want to start by thanking all the faculty and staff for the tremendous work that you've done in the past year. I know that pivoting from a virtual learning and working environment has not been easy. You've navigated these difficult times with creativity and with a spirit of innovation for which Mac is known. I want to thank you for the energy and a positive spirit that you've shown throughout this year. As many of you know, our Return to McMaster group has been working regularly since its formation in February, drawing on the expertise and experience of McMaster's researchers, staff, faculty, and students. We're all focused on making decisions that are evidence-based. As always, we're putting the health and well-being of our community first. Looking over the questions submitted for today's events and based on my conversations with McMaster community members, there are several themes that have emerged. Flexible work environments, safe workspaces, masking and vaccinations, and the ever-present questions about parking. Today, the panel will try and answer as many questions as possible. We recognize that there's a great deal of unpredictability in the coming months, but we're optimistic and we want to see as many activities on campus as possible this fall, particularly for our students. We know that there are many questions. One of the most challenging is around the capacity on campus for the fall. We continue to work with public health to help answer that key question over the summer. In the meantime, we'll continue our planning to be ready for any scenario. We'll focus on making the fall term a safe and engaging experience for our students. So thank you again. Please take care of yourself, wear a mask, maintain physical distancing, and stay safe. I look forward to seeing you all soon. I'll now return the town hall back to our provost, Susan Tighe.
Thank you, David, so much for those welcoming words. All right, so let's get started. We have a lot of questions that we have received. Our first few questions are some of the most upvoted and most asked by staff and faculty. And so I'm going to ask Wanda McKenna, who looks after our human resources, to help answer some of these questions with me. So the first question is, will McMaster embrace a hybrid work model and continue to allow staff to work remotely at least some of the time post-pandemic? And the second part of this question is, when will a decision be made about whether employees can work remotely some or all of the time, and how will this decision be made? So Wanda, how about you start the answer, and I will also add some comments as well. You're on mute, Wanda.
My apologies. Thank you, Dr. Tighe. First, let me say to everyone, thank you for joining. I hope you and your families are doing okay. With regard to hybrid work options, this is a great question and one that's on everyone's mind. We've heard from staff and faculty that the flexibility offered by remote work is important to them. While remote work was quite unusual for most of us pre-pandemic, many of us have come to enjoy the new work arrangements. Looking to the future, we want to be innovative in how we think about the employee experience. We need to allow leaders and staff time to consider opportunities and learning from the pandemic, and to pilot arrangements through the fall that consider the services and the work that we need to deliver, and also employee wellness and your individual interests in flexible work arrangements. We've been thinking about ways to enable this. For administrative and support functions, the university is taking a remote-first approach to the fall. This means that many areas can continue to operate remotely with minimal on-site presence, allowing the focus of resources to be on students for in-person learning and experiences where possible. Continuing to limit who's on-site makes it safer for those that are working on-site. For student and faculty services, the university will be asking students to first connect remotely with that unit or office to determine if an online or in-person appointment is needed. This enhances accessibility for our students and provides some guidance to departments that are considering what service levels should look like. Balancing health and safety requirements, operational needs, and student experience will all need to be considered. We're asking leaders to be inclusive and understanding of the needs of staff for flexibility, especially during the fall, and exploring new ways of work wherever possible. As mentioned by Dr. Tighe, it's important that we also acknowledge that some employees have been working on-site throughout the pandemic. This includes staff and faculty who've been performing important clinical work, some research work, working in the nuclear reactor, in the student wellness clinic, residents, facility services, and some hospitality staff, just to name a few areas. We've taken extra precautions to ensure these groups have been able to continue to work safely. We're all so very impressed with the work of these teams, and we thank them for their incredible efforts through this challenging time. We also recognize that hybrid working arrangements may not be possible for all, dependent on the nature of the work that they perform. Each department and faculty will be determining the appropriate level of on-site presence for their area, and we all need to expect that the fall will continue to be a time of transition and change. I can assure you that leaders are working to provide guidance to their teams in the coming weeks.
Thanks, Wanda, for that. And while we're on this question, I'd like to just take a moment to speak about the winter 2022 term. And I want to note that as vaccination rates across Hamilton and Ontario continue to increase and COVID-19 cases counts continue to fall, we are becoming increasingly optimistic about the winter 2022 term, that we will be very close to our pre-pandemic operations in terms of ongoing student campus life and learning activities. We will continue to bring staff back to campus gradually to support these activities. But as Wanda mentioned, we will be applying the lessons learned through the last year and a half of the virtual work environment to continue to innovate in the future. The pandemic has changed the way we operate forever, and we want to be harnessing these lessons learned on increased flexibility and new working arrangements. More information on winter 2022 and our operations will be shared throughout the fall term. Okay, on a related note, we received some questions about equity across faculties and departments in terms of working arrangements. So I'm going to again ask Wanda to comment on the following question. And the question is, how will McMaster ensure equity across faculties? Some staff are forced to work on campus, while others will be doing the same or similar work from home. Wanda, over to you.
Thanks again, Dr. Tai. This is a great question. We're certainly encouraging managers and supervisors to be as flexible as possible as more individuals transition back to McMaster. Leaders will be asked to identify roles that need to be on campus and provide flexibility to the extent possible for roles that do not need to be on campus. Human Resources and the Equity and Inclusion Office can certainly help support these discussions and decisions. Faculty leaders and administrative leaders will align where possible on approach and working arrangements within departments. Steps are being taken to help facilitate this planning. It's important to realize that varying operational requirements may mean that individuals in similar roles may not always have identical working arrangements. We are encouraging leaders to be flexible, inclusive, and to consider individual and department needs as much as possible, and to consider pilot and trial arrangements for the fall.
Great, thanks Wanda for that important note. We also wanted to ensure we provided an update on research operations throughout the summer and fall. I will turn it over to Dr. Karen Mossman, our Vice President Research, to provide an update. Karen?
Thank you very much. For the research community, we have been at this for the better part of the pandemic, with essential and COVID-related research maintained from the very start. We created a system or a portal to bring research teams back safely and to ensure all public health and university guidelines are followed. And we've more than just maintained the status quo. We've actually elevated our activity with nearly 60 million in COVID-related funding alone. Over the past 16 months, and as the situation continues to evolve, we have and we will keep the community posted through direct emails from our office, but also on our research website. The default is always to work from home if you can. And more recently, we moved to a more liberal version of our previous phase 2. And this is given that there is an increase in vaccinations, a decreased caseload, and also advice from our infectious disease experts. We just transitioned to this updated phase 2 on Tuesday. And this phase allows for increased activity for both on-campus and fieldwork research with the approval of your associate or vice dean of research, and in some cases from our office. We recognize that it has been a struggle for some. Therefore, we'll be conducting a survey to identify what the impacts of COVID have been on your research community, and also to identify areas where we may be able to make a difference moving beyond the pandemic. Therefore, we'll be hosting some roundtables called COVID Recovery Conversations starting next week, and again in the fall to really complement the survey. And you should be receiving information about this shortly if you haven't already. So overall, I want to thank the research community for all that they've done since the beginning of the pandemic, for your patience, for your diligence, and for your resourcefulness. McMaster in many, many ways has led, and this is really thanks to all of your efforts. So thanks very much.
Thank you, Dr. Mossman, for your leadership. And I can just say in all of our planning, we have really appreciated the contributions that have been made by various faculty members across campus, various researchers who are providing us with up-to-date information so we can really be a leader in this area in our Back to Mac activities. So I just want to also personally thank the many folks that have been involved in this process. All right, so we're going to turn our attention right now to masking, vaccinations, and workplace safety. So the first question related to this is how to deal with anti-mask, anti-vax students or visitors, and will there be a mandate around vaccinations on campus? And then the second part of this question is what safety measures will be in place to keep me safe? Will screening be required? So I'm going to ask Wanda to comment initially, and then I would also share some comments related to this topic.
That's great. Happy to jump in. We know that a number of safety measures have been in place through the past year and will continue into the fall. First, with regard to masking, public health continues to require masking, or in some cases, a face shield if masking is not possible for an individual. For both indoor spaces and outdoor spaces where a distance of 2 meters cannot be maintained. As we've been doing all along, McMaster will continue to follow all public health guidelines into the fall, including this mandatory masking expectation. We anticipate that all members of our community will cooperate with the masking requirements and demonstrate care and respect for others in doing so. In keeping with kindness and respect for others, we will take a multi-pronged approach to education, frequent reminders, posted signage, and information sharing to ensure compliance with masking. Should you encounter someone who's not wearing a mask when you're on campus or a face shield, please ensure that you maintain a physical distance of at least 2 meters, and we ask that you speak with your supervisor. Based on what we know today, provincial health and safety guidelines will also require that faculty and staff coming to work on site will still need to complete active screening each time before you arrive on campus. Of course, we'll also still require that faculty and staff complete their COVID-19 awareness training before they return to the work environment on site. So far, we've had over 12,000 staff, faculty, and students complete this training. And I can also add that we're in the process of updating this training, and you can expect to see an updated video posted in the coming weeks.
That's great, Wanda. And I assume that that will be available on the Return to Mac website so that we can all keep ourselves updated. And Absolutely. I believe that we're also going to have some direct emails as well related to this. So in terms of vaccinations, this is a question that we have considered very carefully and have collaborated closely with Hamilton Public Health to determine our plan for community vaccinations. The government of Ontario has not mandated vaccinations in the workplace or in schools. So in line with this policy, we are not requiring students, staff, or faculty to be vaccinated before coming to campus. However, we are strongly encouraging everyone to get vaccinated as soon as possible, as soon as they are eligible, as vaccines are an important step towards moving out of the pandemic. As Wanda noted, we will continue to require many other safety measures such as mandatory masking, cleaning and disinfection, and physical distancing as layers of protection for our community. I'd also like to share with you that we recently sent a survey out to McMaster students on their intent to get vaccinated. To date, we have collected 18,000 respondents, and almost 94% have indicated that they have already received their first vaccination or will receive their first vaccination by September. That is great news. That 94% is just outstanding. In terms of our students that are coming to live in residence, the results are even better. 97% of our students coming into residence have indicated that they intend to be vaccinated or are already vaccinated. McMaster is a community about health. We care about each other, and we are really impressed that our students are responding to this as well. All right, we have a question for Dr. Paul O'Byrne, and this question is, what has been done to improve ventilation, including the health sciences buildings? Is there a new standard in terms of air exchange or air quality? And how is it being monitored? And in MUMC, will ventilation be improved in the outer stairwells? I just want to note again that our Faculty of Health Science is world renowned, and we're certainly happy to have Dr. Paul O'Byrne with us here to share some perspectives.
Well, thank you very much, Dr. Tai. Good morning, everybody. So a specific answer to the question that Dr. Tai has posed is that the Health Science Centre, which we also know as MUMC or McMaster Children's Hospital, operates under Canadian Safety Association standards related to heating to ventilation and air conditioning. This is known as HVAC, and these requirements exist across the province in Canada for all healthcare facilities. The air handling units in the building do undergo a comprehensive preventative maintenance program, which must be and is fully compliant with the Ministry of Health guidelines. And each air handling unit is fully checked at least once every 6 months. The filters installed in the units are MERV 14, which comply with the CSA standards for these units, serving healthcare facilities and their replacement programs. Now, the external stairwells and staircases are always positively pressurized with 100% treated fresh air. The air change rates per hour comply with the CSA standard, and during the pandemic, there was no major COVID outbreaks in health science centers, very fortunately, other than obviously the patients admitted for direct patient care because of their contact with the virus. So infection control measures remain implemented as required by the Ministry of Health requirements.
Great, thank you, Dr. O'Byrne, for that important information. We also do have a live question, and the question is, or the comment really, I guess question/comment is, I'm assuming evolving COVID guidelines and restrictions. As these guidelines evolve, will McMaster's evolve as well? And so my comment to that is yes, as vaccinations are still going up, and if public health guidelines change, then so will our restrictions change. Great question, and thank you. Okay, we've also received another question here for Wanda. And so Wanda, can you come back on, please? And so for clarity, it will be up to each faculty leadership to decide if their staff can work from home or not. Can you please answer that question?
Certainly, happy to provide a little bit more clarification there. What we're actually doing is working with each one of the faculties and each one of the larger areas on campus, specifically through their deans and their AVPs, to help coordinate where individuals are going to be asked to work on campus or remotely. More and more of this will become clearer in the coming weeks, as we do have a number of sessions booked with leaders to be sure that we're talking about this and helping areas to work through the specific questions.
Great, thanks. And thanks as well for those live questions. As I said, we'll do our best to answer as many as we can. Okay, the next question is for Dr. Kim Dai. And the question, Kim, is, has or will the university increase staffing to support the staff and faculty who are managing workload for hybrid activities? And this includes classes, events, etc. So over to you.
Great, thank you. Good morning, everyone. So I can certainly speak to classes and student academic experiences. As a result of the pandemic last year, in April 2020, the McPherson Institute proposed a plan to offer a variety of supports for our teaching community. And this was in anticipation of virtual teaching that would be occurring in fall 2020 and in winter 2021. And this proposal that was approved through the Provost's office allowed the McPherson Institute to hire 21 temporary positions that would help support increased remote teaching needs of all of our instructors, faculty, and staff across McMaster. This included a number of different positions. 8 were contract educational developers. They supported new course development, adjusting courses to the online learning environment, consultations for faculty across campus, ways of optimizing student engagement in the online environment and in the blended environment, review of course content and assessments, and the creation of a plan to refine future iterations of the courses as well. We didn't want this to just be a Band-Aid pandemic solution. We wanted these resources to be able to inform our teaching in the future as well. So in total, 50 courses and over 8,000 students were directly impacted by those additional supports. We also hired 11 educational development fellows. They were hired to support 6 faculty-based teams in consultations and workshops, and also to develop resources that could be used into the future as well. They also assisted with delivering the fall experience survey, and I shouldn't say just deliver, they did all of the analysis around that survey as well. We also had 2 temporary learning technology staff who were hired to provide additional supports for the Avenue support team, as well as for providing supports for online proctoring and installation of the Respondus tool. Through the McPherson Institute, supported by the McPherson Institute, we also found that many faculty and staff found that additional supports from students was really valuable, not only in preparing their courses, but also for delivering the courses through the 2 terms. So fortunately, this support will continue. This support was critical for enabling everyone to adjust to the new realities of remote teaching, and we have requested additional support to continue these resources into spring of 2022. And this will allow us to continue with all of the online teaching supports that worked really well, but also change as necessary for a flexible and hybrid environment. In addition, we have updated Avenue to Learn supports, provided more standardized templates to more easily access those tools and provide them to our students. And our classrooms are being equipped with Echo 360. This is a lecture capturing tool. This is one version of hybrid teaching. It's not the only version, but it's a very simple tool that can be switched on and off. For most of us, we won't have to do anything. We'll just deliver our lectures and those lectures will be captured, but we will also provide supports in the background to make sure that those are seamlessly uploaded into Avenue to Learn.
Great, thank you so much, Dr. Dye, for that explanation. And I just want to reinforce that we are very committed to high quality education. This is our core business. Students are our core business. We have made substantial investments into ensuring that our instructors have both the human resources types of supports, but also the physical types of supports. And we're very proud of that. I mean, it's so critical to our ability to deliver high quality education across the institution. Clearly, I need another coffee. So I'm going to switch gears. Thank you so much. I'm going to switch gears for a moment, and I'm going to ask Dr. Al-Shaba to come and answer a question for us. And the question is, what precautions will McMaster be implementing to ensure that the rising hate towards their Asian student population will not affect commutes and campus life? Very challenging question, but Dr. Al-Shaba, I'm turning it over to you.
Thank you, Dr. Ty. So first, I guess let me just say that I'm sorry that the question needs to be asked to begin with, but also glad that we have an opportunity to be absolutely clear that McMaster welcomes diversity and takes very seriously the task of building an inclusive community. And that means that we must oppose hatred and bigotry. So we'll continue to communicate our commitment and expectations that students, faculty, and staff are able to learn and work in an environment that's free from harassment, discrimination, and hate. And if any community member has any concerns or complaints that relate to hate or bias, whether they've personally experienced this or witnessed an incident, we really encourage folks to please contact the Equity and Inclusion Office, and that's equity@mcmaster.ca. We do have, the university has, through the Equity and Inclusion Office, a discrimination and harassment complaint protocol. We have something called the Blue Folder that we're going to be pushing out in the fall. It's linked to our website, but we will continue to push that out to our community. On campus, we also have proactive anti-racism education for community members. And importantly, we do have support and discussion groups for Black, Indigenous, and racialized students, faculty, and staff. So we welcome folks who are needing support. I will say, most importantly, because the question focuses on hate and potential hate crimes, that we do work collaboratively with campus security, who liaise with Hamilton Police. And so where there's reports of possible hate-motivated crimes which occur on or off campus, and the question related to transit to campus, so there may be incidents that are happening off campus, let us know. We'll work with campus security and they'll liaise accordingly. And there are also a couple of community groups, organizations in the community, the Hamilton Center for Civic Inclusion, that's provides support, education, and advocacy, and also a newly launched Hamilton Anti-Racism Resource Center that's going to be looking at tracking incidents and education. So thank you for the question.
Yeah, that's a great question. And again, if you are experiencing any type of racism, regardless, please contact us. This is a priority for us, so please do reach out to us. Okay, I do have a live question here that's come in for Kim, Dr. Dye. So I'm just wondering, Kim, if you can come back here for a moment. And the question is the additional support that you were speaking of earlier going to continue to be only contract positions, or what does that support look like?
Perfect. Thank you, Dr. Tai. So for this year, for 21-22, we will extend, we have already extended the contracts for all of those folks. They are amazing people. They've brought such depth and experience to thinking about both online and virtual learning, as well as blended learning into the future. So we wanted to make sure we were keeping them and valuing the work that they've done. Will these be permanent positions into the future? That's kind of a question we have to ask at a much higher university level. We are establishing a digital learning strategy that will explore and look at what teaching and learning will look like at McMaster in the future, specifically around those digital learning resources and what blended learning will look like. We don't want to leap into decisions about becoming an online university, but there are great ways in which these online resources can enhance the learning of our students and actually make the hands-on learning even more meaningful. So we are exploring that as part of the digital learning strategy, and we will bring forward recommendations to our provost and to the deans as well.
Absolutely. I mean, I think that the key point here is we want to take the important lessons learned and really rethink about how we deliver education in many formats. So thank you, Kim, for answering that live question. I'm going to move on and switch gears a little bit here. And really, there were a number of very highly upvoted questions related to areas that cut across campus and cut across the universities. So as I start to pose these questions, I'm going to have a few of our leaders share information from their respective areas. And so as a starting point, I'm going to ask Wanda McKenna from HR and Debbie Martin from Facilities and Dr. Paula Byrne from the Faculty of Health Science to comment on this first question. And the question is, will we be expected to meet in person? How will you improve ventilation and enforce social distancing? Will a divider on a desk be enough to prevent airborne virus? And I'd also like to note that we've had a number of questions coming in about safety and ventilation in other buildings on campus. So if the three of you can tackle that, I would be grateful. Thank you. Over to you.
Thanks again, Dr. Tai. Debbie, why don't I get started and then I'll pass it over to you. So when we think about meetings, this is another area where certain decisions have been made for the fall that respect that this is a time of transition. What we've done is committed to holding administrative meetings virtually for 2021. This should also include department and team meetings, depending on the size of the group and what public health guidelines allow. A decision has already been made, for example, that the university governance meetings will be held virtually this fall. Of course, this will certainly be a topic where we'll continue to follow public health guidelines. And as students return to campus, there may be some in-person meetings for clinical or research activities that are already on site. Debbie, did you want to jump in and talk about ventilation and space?
Yeah, I can do that. Thanks a lot, Wanda. I just want to start by saying how excited I am to get an opportunity to talk about coming back to campus. I think lots of us have been waiting for a long time to start engaging in these discussions. Safety continues to be the top priority for preparing our indoor spaces for returning to campus. And I'll start the ventilation question really by talking about three different areas, but Also, just a note that ventilation has been top of mind for our utilities team, and I know it's top of mind for everyone on the call today, so I'll try and give as much information as I can. The first thing that they're doing is really trying to ensure that we maximize fresh air and keep air recirculation at a minimum in all buildings. We're currently inspecting all of the lecture halls and classrooms to ensure that the spaces meet ASHRAE design standards for ventilation. And what ASHRAE is it's a recognized society in North America that provides standards and guidelines for ventilation and indoor air quality. We're also in the process of installing high standard air filters called MERV 13 air filters in all buildings where air is recirculated before in-person learning begins and before staff and faculty begin returning in larger numbers to campus. A MERV 13 air filter has a higher capacity to capture normal kind of fine particles from the air that recirculates through the system. We're also increasing the frequency of air filter replacements, and we have that planned for the fall. In our residence buildings, most of the student areas are operating with 100% fresh air, and where air recirculation does exist, they will also be fitted with MERV 13 filters. McMaster will continue to monitor for any further ventilation guidelines from public health. And that goes to the question that Dr. Tai answered a few minutes ago about as we learn more information, we will be modifying and adjusting our protocols and our processes to adapt to that. And the utilities team will ensure that our HVAC systems are functioning as they have been designed to function, which again is with those same ASHRAE standards. There's a piece in this question about planning spaces for fall, and I want to ensure that you understand that we will be looking to maintain the 2 meters of physical distancing between people indoors on campus. So whether it's a classroom, a lecture theater, or any other indoor space, the classrooms and lecture theaters have all been assessed. Room capacity limits have been set, and we'll be adhering to public health guidelines in those spaces. We now understand that we need to turn our attention to some of the more administrative spaces on campus where staff or faculty are returning. If it's not possible to maintain 2 meters of physical distance in these spaces, there may be a need to redesign or modify the work areas. This could include moving furniture, using vacant office spaces, rotating employee schedules, or installing barriers such as plexiglass. Plexiglass would be used only after all other considerations for spacing individuals have been reviewed, mainly in client or student-facing areas like a service desk. It should be noted that these measures don't replace the need to wear a mask indoors. So we're not looking to install plexiglass so that staff or students don't have to wear masks. In addition to preparing the indoor spaces, we're also trying to reimagine our outdoor spaces on campus to maximize opportunities for people to learn, study, socialize, or collaborate outside in fresh air. We're creating those outdoor spaces while considering the needs and comforts of our students, staff, and faculty, and including a lot of additional seating and strong Wi-Fi. Our UTS group has been working hard at the wireless connections on campus, and we've looked to position seating areas around where those Wi-Fi internet connections are the strongest on our campus. So Dr. O'Byrne, I think I'm going to turn it over to you to talk about how the virus is spread and what we're doing there.
Well, thanks so much, Debbie. So we have learned so much about this virus since the original reports of a new respiratory infective virus in December 2019. It's a year and a half since that time, and over then we have understood that, as with indeed all respiratory viruses, this virus is spread predominantly through aerosol spread. And that's, of course, generated mainly by coughing and sneezing. We've also now, I think, come to a very clear realization that to minimize risk, we do need a multi-layered approach, which includes, of course, masking, physical distancing, enhanced cleaning, and of course, most importantly, the need to encourage full vaccination for everybody as soon as is feasible.
Thank you, Dr. Paulo Byrne. And I would just again like to comment a lot of the lessons learned about this virus. Many of our researchers across campus have been part of that, researching this and providing these lessons learned, which of course have been shared internationally. I just wanted to make a note that we are up to about 880 live participants in the town hall. So thanks for joining us. Also wanted to say that yesterday we had close to 800 students join, and our video has already been viewed 2,500 times. So really happy to see this engagement of our community. We do have another live question here for Wanda. So Wanda, if you can come back for a moment. And the question is, does the employee's right to refuse unsafe work extend to concerns related to their physical workspace on campus and COVID? Great question.
That's a great question. Thanks again. First of all, I'd hope that we've addressed all the health and safety concerns and something like this wouldn't be necessary. But I do want to emphasize that the university follows all of the Occupational Health and Safety Act requirements, which includes protocols for refusing unsafe work. If you are believing that your workspace is unsafe, I'd encourage you to start with a conversation with your supervisor. From there, we have protocols in place that would involve our health and safety teams, joint health and safety committee, including worker reps. And hopefully we'd be able to work through the areas and the topics quite successfully. So yes, it would certainly extend. And yes, we do have protocols in place.
Great, thanks for that. Extremely important. If you don't feel safe, talk to your supervisor. Okay, so we also have a live question here for Kim. So Kim, I'm hoping you can come back. And the question is about what about student-facing meetings for advising? Will those be in person?
Thanks, Susan. Yes, great question. I'll point out that the associate and assistant deans and I have been meeting weekly since last March, and many topics such as this have come up. What we have suggested is that the first point of contact for students will be online, as it has been the past year, so that there will be ways to email the advising offices or to contact them using an online web app. Through that online communication, then a follow-up meeting can occur, and that might either be online or in person, and that will depend upon our public health regulations. It will depend upon the comfort level of the student and how they can access campus, and also depend upon the nature of the questions that are being asked, so that there will be flexibility after that first point of remote contact. And this is what we recommended for the advising offices across campus, and the assistant deans agreed that this was the best way to move forward. This is also consistent with, in talking to Sean Van Koenen in Student Affairs, consistent with student resources across campus. For anything in student supports, the first point of contact will be online, and follow-ups will either be online or in person. And this will definitely will provide flexibility. It will also stop all of those very long lineups that I, for one, have seen outside of the Faculty of Science offices down the halls, but across campus as well. We don't want students being frustrated waiting in long lineups, especially if there's increased anxiety around distance and masking and all of those pieces.
That's great, Kim. Thanks for answering that. And I just would like to note that if you are interested in more of the student resources and how we're addressing student needs, you can certainly tune into the town hall for students, because I think a lot of the answers that we talked about and a lot of the questions we talked about are relevant as well for faculty and staff. So I would encourage you to take a look at that town hall as well. Okay, we're going to switch gears a little bit here now, and there's a number of questions that came in related to transportation and parking. So I'm going to call on our Chief Facilities Officer, Debbie Martin, to help address the first question. And the question, Debbie, is, will there be parking options that provide flexible work from home days during the week? Over to you.
Thanks, Susan. So the quick answer to that is yes. We are looking to support different approaches to parking on campus for the fall. We have obviously those who will continue to work from home and will want to have the ability to put their parking pass on hold for the fall semester. So we will be enabling that for anyone who's working at home full time. For those who are coming back to campus full time, obviously you can reinstate and your transponder will work as it did pre-COVID. And then we have some people that we know will be coming to campus on a part-time capacity. So we've been working with human resources around what some of those scenarios might look like. And we will be offering a part-time pass for new or existing parking pass holders at a reduced rate for the fall term. Information about this will be out over the coming weeks. This is in place. Really what we're looking to do is have this in place for the fall. We know things for winter are still evolving, so we'll continue to assess this over the fall and communicate plans for the winter term when we get closer. But this is what we're looking to do for the fall.
Okay, that is great. And then a second related question, which I'm going to ask Wanda to tackle, is will there be any accommodations made for employees who use public transit to access campus? So for example, if bus routes are still canceled or reduced, how will we address that? So Wanda?
Yeah, I think this is an area where, of course, there's so much unknown for the fall right now. And what HSR service routes will be is a great example. So as mentioned, we're asking leaders to be inclusive and to prioritize flexibility for their teams when a return to work or a partial return to working on site is identified. This could include different start or end times to support new circumstances that individuals may have since the pandemic began. We're really encouraging open dialogue, pilot or trial arrangements that work for everyone. We know that so much has changed at home and at work since last year. We are hoping that most arrangements can be made keeping all of this in mind.
Okay, great. So don't run away, Wanda. We have a live question for you. And the question is, Sean Van Koenen, of course, our Dean of Students, who participated yesterday in our session, said that we should only meet in person if needed. Wanda said admin will have no meetings. So why are staff needing to be on campus? That's a hard one.
Well, I think the intention is to help clarify this. So Sean, and of course, if you think about the remote first approach, what we are doing is suggesting that students and individuals look online, first of all, check for the service status, inquire remotely, first of all. And then from there, the different areas can respond appropriately, which might include in-person appointments with students as an example. My reference was with regard to administrative meetings, such as team meetings, department meetings, where we're suggesting we're not going to be bringing people back on campus to have those type of meetings. So hopefully that helps clarify.
Yeah, I think that's great. And I would say that certainly it has been determined that our Senate meetings and the committee meetings associated with Senate and the board meetings will be virtual in the fall term. I did also want to say that we've been in discussions with Metrolinx already, and they have been in contact with us to make sure that they can provide the types of busing services that we do need for people to get to and from campus. So as part of a global and larger transportation perspective, we are working with them as one of our partners. Okay, we're closing in on the last few questions. So the next question, I'm going to ask Dr. Al-Sheba and Wanda to come back and answer this one. And the question is, what new or additional mental health supports will be made available to staff to help the transition back to in-person activities? So of course, this is for staff and faculty. Arig or Wanda? I'm not sure who's answering first.
Why don't I go first, Arig, and then I'll pass it over to you. That's great. You know, mental health is something that is on everyone's mind right now. We recognize and appreciate that COVID-19 has created incredible stresses and mental health challenges across our community. It's understood that many will be anxious about the return to campus. We are approaching the fall, as we've said so far, encouraging flexibility, patience, and understanding. These themes are being emphasized to all, including our supervisors. We all need to be patient, use kindness and compassion, and treat the fall as a period of transition. We're encouraging conversation, sharing of your concerns about returning to work on site, and discussing plans as a team and with your supervisor. As we have throughout the pandemic, we'll continue to offer workplace wellness resources, provide access to supports such as the Employee and Family Assistance Program, and many groups have additional benefits and supports the university's benefit package to promote and support mental health. Reg, did you want to jump in there as well?
Yeah, thank you, Wanda. And I'll just add to share with our community that you and I and several others on this call have been a part of a task force that was established to review and recommend enhancements to initiatives that address health and well-being issues, which we know, as you've mentioned, have been exacerbated by the pandemic, and which, of course, we're going to be needing to consider with the transition back to McMaster. The recommendations are forthcoming. They're going to be going to Dr. Tai for review, and just to let our community know that they are recommendations as a result of a robust consultation process. We've been looking at the data collected internally, campus community data, but also lots of research in this area as well. The entire sector has been looking at this issue, and I can tell you that the recommendations are going to span issues around planning, environments, education, as well as supports, and paying particular attention to how different populations are impacted differently.
That's great. Thank you so much. A really important area. And I just want to reinforce, we are very interested in providing assistance and ensuring that we have the right resources in place. So, all right. So moving along, I have a question for Debbie Martin. And question is, what is being planned for the fall to keep clean, potentially more busy spaces like washrooms and classrooms, and certainly high traffic areas? So Debbie, what's the answer to that question?
Thank you, Dr. Tai. So we have about 150 custodians on campus right now, and they have been continuing to clean and disinfect indoor spaces on campus throughout the whole pandemic. I'm really proud of this team. They have experience cleaning and disinfecting spaces that have been occupied over the last year, because we have had some people, especially in the research area, and some students on campus during this time. So all of these staff are trained to properly clean and disinfect indoor spaces to help limit the spread of the virus and germs on indoor surfaces. On campus, we use high quality disinfectants for cleaning, and we follow industry standards, and they're set by both ISSA and APPA. But they basically are organizations that provide us with cleaning standards for educational facilities and institutions that are used not just in North America, but also worldwide. So we are focusing our efforts on high touchpoint surfaces in high traffic areas. So things like door handles, washrooms, we're going to be doing those spaces on an increased frequency in the fall. We are also going to be doing all classrooms and lecture theaters every evening, and following cleaning, we'll also be using an electrostatic disinfectant spray in all lecture halls and classrooms. Common areas on campus like libraries, eateries, any public indoor spaces will be cleaned and disinfected nightly. Hand sanitizer and disinfectant wipes are going to be available in common areas, classrooms, and in lecture halls. So for people who want to take an extra moment and do some additional cleaning on their own before they use facilities, we will have extra product available for them to do that. And we'll continue to conduct a deep cleaning to disinfect any indoor areas on campus if a positive COVID case has been identified. As you know, our staff have been doing this throughout the pandemic, and we'll continue to do this into the fall. We will also continue to monitor public health guidelines closely, so we'll keep revising that plan as we get closer to the fall. But that's what it looks like for now, Dr. Tai.
That's great. Thank you very much, Debbie, for that clarification. Okay, so we have another question here, and it is for both Wanda and Debbie. And the question is, what safe spaces are there on campus for staff to be unmasked to eat their lunch? So I'll ask the both of you to comment on that. Thank you.
That's great. I'll get started again and then over to you, Debbie, okay?
Perfect. Yeah.
Maybe if I can start with a simple statement that, hopefully that the community can see through the past year, as well as through this session today, that the health and safety of our campus community has been of paramount importance. If you have any questions with regard to safety on campus, we encourage you to speak to your supervisor, reach out to our health and safety teams on campus, or to talk to your Joint Health and Safety Committee representative. This fall, we will be happy to have some of our food outlets back on campus, and we're definitely excited to have some of our hospitality staff back on campus. We've mentioned earlier in terms of the requirement to wear masks on campus. So public health, as we've said, does require that masks be worn indoor on all indoor spaces on campus, sorry. The best practice, of course, when you're on campus is to take a break for your lunch breaks and to take time away from work and eat in another location. We can share that employee lounges are open with appropriate signage for communicating the health and safety requirements. If you do have a private office that you can occupy by yourself and the door can be locked, you're able to remove your mask and eat there. Debbie, did you want to speak about some of the other spaces?
Yeah, so Wanda, I think that I just really want to focus on the fact that we're also really trying to maximize the use of outdoor spaces on campus. So you all know that we have lots of green space on campus that has, primarily in the past been grass. We're turning those areas into spaces that people can use outdoors during the nicer months. So we're doing everything from Adirondack chairs, new benches, lots of picnic tables, some tented areas around those spaces on campus. We're going to paint some circles on the line outside of John Hodgkins Engineering and Burke Sciences. So for those who want to sit on the grass and eat, you can be sure that you can be in a socially distanced environment. And as I mentioned before, we're coordinating those areas with Wi-Fi use. So for people who do want to be on their phone or any other device while they're on a lunch break, they can use those. But we're really hoping as much as we can that people will use our outdoor spaces on campus. We have 300 acres on campus, so there's lots of places to walk, lots of places to sit outside, assuming weather permits. And we are going to also be putting up some tented areas just in case the weather's not wonderful or if you need to get out of the sun.
That's great. Personally, I can't wait to see campus and see all these wonderful outdoor spaces. I think we are actually going to really enjoy spending time outside. So let's hope it's a nice fall. All right, so there is one last question here for Wanda. So don't run away on me here, Wanda. And the question is, will there be transparency regarding COVID cases on campus? What will be the protocol for students and staff when there is an active case reported?
Absolutely, we can answer this. And this has actually been something that we've been doing all along. So we have set up a protocol for reporting of any positive cases on campus. There is actually a tile in Mosaic where if an individual has been diagnosed as positive that has been on campus, we are asking that they go into that site and report their positive diagnosis. What happens from there is the information goes to either our occupational health nurses in case of faculty and staff, or to student health in terms of students. The information and of course the identity of the individual is kept confidential that way. What happens as well then is there has been a COVID rapid response team. So from there, what we are doing is looking at the spaces, not necessarily knowing who the person is, but certainly being sure that the spaces have been cleaned. And then of course, also reporting back to the campus community. Each one of those positive cases have been reported on the daily news. And you can also see that we've been tracking positive case tallies overall in terms of one of the links that you'll see from the former COVID-19 site, and I guess now the Back to Mac site. So hopefully that helps.
Right. And I would just reinforce, if you have any questions, please refer to the Back to Mac website. We are going to be keeping it updated. There will be regular and frequent updates. So if you go to the website and you can't find it, certainly you can reach out to your supervisor and there are supports in place. So it's hard to believe we're 1 minute out from finishing. I just again wanted to thank all of my colleagues today for joining me on the panel. On behalf of Dr. Farrar and myself and the rest of the senior administration team at McMaster, we really appreciate you participating and asking your questions. We appreciate all the hard work you've been doing either on campus or virtually. We are super excited about returning to campus this fall, and whether you'll be joining us virtually or in person, we look forward to seeing you. So I just wanted to remind you that all of the questions that have been submitted to today will help inform McMaster's Back to Mac website. So please do, as I said, check the website frequently. I also wanted to take a moment to thank all of the staff who worked incredibly hard behind the scenes to put this town hall together. We had many communicators who helped source answers and help prepare. I would also like to personally acknowledge our event leads, Robin Obermeyer, Tina Depko, our technical lead, Dan Kim, our facilitation staff, Monique Beach, Mary Tawes, Kareem Basiri, Christine Yakuch, and Megan Biska. And finally, I wanted to wish you all a rejuvenating summer. Please take some time off. Enjoy your time with your family. And it's going to be a busy fall, but we are a team and we look forward to seeing you on campus. So thanks everyone, and keep well and stay healthy. Bye for now.